Hello, my name is Sheena Bettis, and this is my course project for Concepts of Environmental Health, ESHH 511. For my focus today, I will be talking about the occupational health and safety of the agricultural worker. From the beginning, agriculture has been relied on heavily to sustain our population, or the US's population. Farms started out very small. Generally, they were run by either slavery or they were family operated. But as time happened, crop specialization did occur in a lot of farms, and farms tended to increase in size. Because of the size increase and the end of slavery, there was a demand for seasonal workers, and this drew in a lot of migrant families. Urbanization and technology had also had an impact on our agriculture. It did change the way a lot of farms were operated. Because of the improvement in technology, there was an increased use in machinery. Farming methods changed quite a bit, and we also started using herbicides and pesticides. Because of all of this improvement, running a farm actually became quite expensive, which it is still now today. And this actually increased the need for inexpensive seasonal workers. During World War I, our men were being sent off to fight in the war, and we had a lack of agricultural workers. This started the Immigration and Nationality Act of 1917, and this actually gave a legal basis for the importation of seasonal immigrant workers. During the Great Depression, we actually, of course, had a lack of jobs in the US, and at this time, a lot of migrant workers were deported back to their homelands. During World War II, there was an increased need for agricultural production and a lack of workers. And this actually started the Bracero Agreement of 1943. It was an agreement between US and Mexico. It was how a lot of laborers began to be imported back to the US for seasonal or migrant farming. Historically, agricultural workers have always had poor living conditions and a poor occupational environment that brought a lot of health hazards. But it wasn't until the making of Harvest of Shame that these disparities were brought to light. Harvest of Shame was actually a documentary that showed these disparities that migrant farm workers face. It did include the occupational health hazards and their standard living condition. During this time, we also had a lot of work done by Cesar Chavez and a couple organizations, Agricultural Workers Organizing Committee and National Farm Workers Association. And what these groups did, towards the end, they achieved union recognition and actually increased the living wage of the agricultural farm worker. Unfortunately, a large portion of agricultural farm workers still live under the poverty line today, but their wages did improve from the actions of these organizations. So from the documentary and the work done by the other organizations, the government did start noting poor social, economic, health, and educational conditions of farm workers. And because of this, there were actually some programs and policies put in place to help improve the health of an agricultural worker. One such program, which is known today as the Migrant Health Program, is actually responsible for allocating funds, facilitating interagency cooperation, disseminating information, and monitoring the health of migrant workers. It actually helps fund a lot of our county and migrant health clinics that provides preventative and primary care services to the agricultural worker. Another act put in place by the government was the Migrant and Seasonal Agricultural Workers Protection Act. And what this does is it requires employers and organizations providing housing and other benefits to the agricultural worker to actually meet certain criteria, minimum criteria, when dealing with these workers. Although there were some services and policies put in place to help improve the living standards and health of an agricultural worker, there's still a lot of existing health disparities today. Because of the many existing disparities within the agricultural worker and their family, I chose to focus my research on the worker's occupational environment and how that impacts their health. Many studies show that there is actually a large portion of agricultural workers that identify as a racial or ethnic minority. One such study done by the National Center for Farm Worker Health in 2016 surveyed 165 community and migrant health centers and showed that majority of the migrant and seasonal patients seeking care at these clinics were adults between the ages of 18 and 64, and a little over half were female. 90.5% of the patients identified as Hispanic or Latino, 36.3% were uninsured, and 63.5% lived below the poverty level. Although many studies do show that there is a large portion of ethnic and racial minorities being affected by agricultural employment, they do state that there is poor documentation strategies when it comes to documenting the demographics of the migrant worker. And to better understand what our migrant workers are going through, we do need to have better documentation practices. Now, there are many occupational hazards that an agricultural worker faces, but the ones that I'll touch on during this presentation are their increased exposure to pesticides, their increased exposure to sun and heat, the use of hazardous machinery, their increased exposure to musculoskeletal injuries, and their increased exposure to respiratory illness. So agricultural workers are typically exposed to pesticides on a daily basis. It's normally through direct exposure via inhalation or skin contact. And this is typically because they're treating the crops at the farms they're working on. A lot of this exposure actually has a lot of negative health impacts. It could lead to neurological disorders, respiratory illness, and even death. And because they're working with a lot of poisons, there's also an increase in danger with them bringing their contaminated clothing home. So if they do this, they could potentially be exposing their family or their children to these poisons. And along with this, they also have little access typically to bathrooms when they're working out in the fields, and they don't have as many hand washing facilities. So they could potentially be touching food and other objects and contaminating those objects as well. There are some existing protection standards or policies in place at the time to help protect agricultural workers from pesticides, one of which is the Worker Protection Standard. So this basically says that field workers must be trained on all pesticide use. By training, they're hoping that agricultural workers will use best practice and try to prevent as much exposure and contamination as possible. The OSHA, Occupational Safety and Health Act, also requires that employers with 11 or more employees provide drinking, toilet, and hand washing facilities for agricultural workers while they work in the field. So this is beneficial for workers that work on large farms, which is a very common thing today to have more than 11 employees at a farm. But if you are working on a smaller farm, this OSHA policy is not necessarily required. So agricultural workers are at an increased risk of heat-related illness due to the nature of their work. They are typically working outside in adverse weather conditions. Many times they're out in the sun for hours. And they could potentially be using a lot of heavy equipment or wearing long sleeves and pants that actually affects their body temperature. Because their body temperature is increasing, it could lead to a lot of adverse health conditions, including dehydration, electrolyte imbalance, neurological issues, organ failure, and in extreme cases, death, especially if they're not using a lot of preventative practice and staying hydrated. There is an OSHA law in place that puts employers responsible for providing workplaces free of known safety hazards, and this does include extreme heat. Employers must provide workers with water, rest, and shade, and they should allow new and returning workers to gradually increase their workload and take more frequent breaks just to adjust to the heat exposure. And they should also be able to plan for emergencies and train their workers on prevention. Although there are some laws to protect employees from the dangers of sun and heat, some studies have actually shown that agricultural workers have shown signs of heat illness and have little access to regular breaks. So my question would really be how this law is being enforced at these rural farms to make sure that our agricultural workers are getting the breaks and the water that they need to stay healthy. So many agricultural workers do use a lot of hazardous tools and machinery in their work, and it has led to actually a lot of fatal and non-fatal work-related injuries. There are certain OSHA standards put in place to help protect the agricultural worker. This includes all tools being maintained in good condition and used according to manufacturer instructions, power tools being properly grounded or double insulated, and all guards or shields being in place. And of course, farm workers using the proper personal protective equipment and making sure that all of their clothing does not have loose ends or strings, and their hair is of course tied back to avoid as many work-related injuries as possible. A lot of labor that they provide at the farm consists of many repetitive motions, and it's typically for long hours at a time. They're bending, twisting, or even carrying a lot of heavy items. At some farms, they're also paid in piece rate, and this kind of gives workers an incentive to work very fast and skip their breaks. And because of this, it puts them at an even higher risk of musculoskeletal injuries because they're doing their repetitive motions at fast rates for long periods of time. There isn't too much protection involving musculoskeletal injuries that I found. There were some recommendations provided for proper tools and padding, and fewer activities with repetitive motions, but I didn't really find any policies or laws put into place to avoid these musculoskeletal injuries. So due to the nature of their working environment, agricultural workers are also at an increased risk of respiratory illness. Their work is typically in a rural setting, and they're exposed to many respiratory irritants, which include organic and mineral dust, animal and plant dust, toxic gas, molds, and chemicals. And what's really concerning is all of these irritants are actually associated with occupational bronchitis and asthma. So it has been shown that there has been an improvement in farming mechanisms that have improved some working conditions, but it has also increased a lot of exposure to these respiratory hazards. In the state of Oregon, our existing protection is a standard called the Air You Breathe, which provides a use of engineering controls to prevent contamination of the air that an agricultural worker breathes. So it does a lot of preventative stuff, including enclosing source contamination. It requires proper ventilation of a work area, substituting for less toxic material when possible. And of course, if an approach is not feasible, or if if a standard is being established, or controls are being established, an employer does have to provide appropriate respirators in compliance with this Oregon OSHA standard. So through my research, I did find that there were quite a few occupational hazards that an agricultural worker does have an increased exposure to, and this in turn does affect their health outcome. There are many areas that do need improvement to really help the agricultural worker. One big issue I found was communication barriers. Many employers contracting seasonal workers do not have an understanding of their employees' culture and even their language. And because of this communication barrier, there is a lot of safety hazards created for the farm worker because they're not being provided the preventative training or even healthcare in a language that they understand. So by providing these educational materials in the proper dialect or language that the employee speaks in or understands, we could be providing a lot more preventative services to our agricultural workers. Another big issue I found was actually with access to healthcare. So although there are some programs and policies in place at this point to help fund clinics that provide free or reduced cost services to the agricultural worker, there still is issues with accessing healthcare. And this leads a lot of migrant farm workers to either ignore their illness or self-treat it. And this could be because they're trying to save money. There's actual physical barriers to the clinic, like accessing the clinic. Maybe they live too far away because the farm is in a rural setting and they live on the farm. They don't have access to transportation, such things like that. They could also potentially be avoiding interactions with healthcare providers for fear of being discriminated against. One program that I found that I thought was actually pretty clever was a program in North Carolina. And what they're doing is they're actually contracting the services of primary care physicians, nurses, and medical students. And what they're doing is they're bringing these providers to the farm to provide healthcare to the agricultural worker for free. So it's a mobile clinic is what it's called, but they're basically bringing a primary care clinic to the actual farm. And this does really help with not only saving money because it's typically free services, but also decreasing the barriers with access. And because the healthcare workers are coming to the farm worker, there's a lot less fear of discrimination. So I felt like this one specific study, or this one specific program, was really beneficial in helping improve the occupational health of the agricultural worker. And it's something I feel needs further research and potentially practice in other rural areas like rural Oregon, where there are a lot of farms. Thank you for listening. I hope you learned something about the agricultural workers' occupational health and safety.